Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle. And I am Jasila Mujib, your host for today. Today we will be discussing about an essential vitamin that is very essential for our daily life, vitamin D. Vitamin D also called the sunshine vitamin, and to discuss about this subject in detail, we have with us Dr. Samir Patankar from Al-HILAL Hospital, Manama Central. He is a specialist pediatrician and he comes with a wealth of experience of more than 30 years. So, doctor, welcome to the show.
Thank you very much for inviting me to join the show today. We will talk about vitamin D and its importance today.
Doctor, what is vitamin D? Can you explain in detail for our viewers?
Vitamin D is an essential fat-soluble vitamin which helps our body to absorb calcium and which is needed for healthy teeth and bone formation.
Okay, doctor. So, how common is vitamin D deficiency these days?
Vitamin D deficiency is quite a common global issue. About 1 billion people worldwide have vitamin D deficiency, while about 50% of the population has vitamin D insufficiency. Vitamin D deficiency can occur in anybody, infants, children, young adults, as well as older people. Vitamin D is more common in persons who are with dark skin tones due to the excessive pigment called melanin, as well as the persons who are covering their full body while going out.
So, now we explained about the vitamin D deficiency. Can you now speak about the significance of vitamin D for a human body?
Okay. Infancy and childhood is a period of rapid bone growth, and due to this it is essential for all infants and children to receive adequate amount of vitamin D. Chronic vitamin D deficiency in children can cause rickets, leading to bow-legged appearance due to the softening of the bones, which can lead to malformations of bones and joints. Similarly, chronic vitamin D deficiency in older adults can also lead to osteomalacia or osteoporosis, increasing their risk of fall and fracture. Vitamin D also helps in improving our memory and concentration, and it boosts our immune system and regulates our hormones and insulin levels.
Now, can you tell us about the symptoms of vitamin D deficiency?
Okay. The symptoms of vitamin D deficiency are bone pain and joint pain, then muscle weakness, muscle pain or muscle cramps, then frequently falling sick, then hair loss, then tiredness, then loss of appetite, not sleeping well, and mood changes like depression.
Doctor, are there any causes for the vitamin D deficiency?
There are different causes of vitamin deficiency. The first and most important is the not getting enough sunlight. Secondly is insufficient vitamin D in your diet. Then third is the babies who are exclusively breastfed don't get enough vitamin D, as there is less of vitamin D in the breast milk. Then certain medical conditions like Crohn's disease, celiac disease, cystic fibrosis, liver diseases and kidney diseases. Then medications like laxatives, steroids, antifungal and anti-epileptic drugs. Then persons who are obese or who already have had weight loss surgeries like gastric bypass surgeries. Then people who are above the age of 65 to 70 years are at increased risk of having vitamin D deficiency, and people who are homebound or they are staying in nursing home or other facilities due to the restricted mobility are also at increased risk of vitamin D deficiency due to non-exposure to sunlight.
Okay, doctor, what is the daily requirement of vitamin D? How much vitamin D should a person have in a day?
Daily requirement of vitamin D depends on the age of a person. Infants from 0 to 12 months require 10 micrograms or 400 international units. Then 1 year to 70 years of age require 15 micrograms or 600 international units. Above 70 years of age, you require 20 micrograms or 800 international units. And pregnant and breastfeeding women also require 15 micrograms and 600 international units.
Can we prevent this condition? What can we do to prevent vitamin D deficiency?
The best way to prevent vitamin D deficiency is to ensure you are getting enough vitamin D through the sunlight exposure and through your diet. Our skin naturally makes a large amount of vitamin D when exposed to the skin. So, when exposed to the sunlight. So, daily sunlight exposure of 15 to 30 minutes is preferably in the morning time between 7 a.m. and 10 a.m. with some parts of your body uncovered is recommended. Also encourage your children to daily play outside and do some outdoor physical activities. Dietary source of vitamin D includes cheese, yogurt, mushrooms, oats, then orange juices, and fortified cereals and milk like almond and soya. Non-vegetarian sources of vitamin D includes the egg yolk, cod liver oil, then beef liver, and fatty fishes like salmon, sardines, mackerel, and tuna.
So, how does a person know that he has vitamin D deficiency? What are the tests to be done?
Uh, to know about the vitamin deficiency, you need to visit your healthcare provider, and he will do a simple blood test to check the vitamin D level as 25 hydroxy vitamin D, and if required, then he may suggest you to take vitamin D supplements.
Now we mentioned about vitamin D supplements. We know that vitamin K is also included in vitamin D supplements. So, why is it so?
Yes, this is a good question. Vitamin D and vitamin K are two important nutrients that work very closely together. Vitamin D, as you know, it helps in calcium absorption from the body, whereas vitamin K ensures that the calcium which is absorbed from the food and supplements is utilized in the bone. That's why both of them are added together.
So, doctor, another common query is during winters when the sunlight is very less, do we need more vitamin D?
Yes, it is true that during winters, if you are not getting enough sunlight exposure, you are staying indoor, or you are staying in an area or in a country where the sunshine is less during the winters, like certain European countries, then you require to, you may be at a higher risk of getting vitamin D deficiency and may require vitamin D supplements.
So, doctor, is there any adverse effects of having more vitamin D?
Yes, actually we should take vitamin D only if required, and that's why it's important to have a vitamin D level check. And adverse effects, or if you're taking vitamin D regularly or it is not, when it is not required, then it can cause hypercalcemia or hyperparathyroidism, and which can cause stones in the renal stones in the body. We can have other side effects like nausea, then vomiting, then you can have again fatigue, tiredness, you can have constipation. So, these things can happen with vitamin D overdosage.
So, now, doctor, what is your advice for our viewers regarding vitamin D?
To the viewers, I would advise is to have enough exposure of sunlight daily, then to include have a vitamin D rich diet, and to check with your healthcare provider or doctors to regularly to have a vitamin D checkup at least once in 6 months or once in a year, and if required, the doctor will suggest you to take vitamin D supplements.
So, thank you, doctor.
Thank you very much.
So, viewers, this brings us to the end of today's talk show on vitamin D. And as you are aware now that vitamin D is essential to boost our immune system, is vital for our bone health, to regulate our mood swings, and to protect us from many vital diseases. For more informative episodes, tune into BMC Global Live every Tuesdays at 8 p.m. Till we meet again next time, this is Jessila Mujib signing off. Good night.